So welcome students. So yet another NEET SS and we have yet another student with us. So congrats Rachit and congrats for getting All India rank 6 in NEET SS. And this time there is some change in exam pattern. We will discuss that also. Like a question pattern, there are some changes. We'll discuss that also during when we are going to discuss. So how are you feeling right now? Like and how
Thank you so much. Thank you so much for the wonderful wishes, sir. Firstly, it is an honor to share this interview with you on a national platform, which is Marrow. Sir, I'm feeling very happy. I'm feeling blessed. I'm feeling satisfied. I couldn't ask for anything more.
and how was your like you did can you introduce yourself? Like I know that you told me that where you did and all. You just tell me where you did your MBBS, MD, where are your hometown, all those details, family, all those details.
Yes, sir. Sir, I'm from Baroda, Gujarat. I did my undergraduation from Baroda Medical College here itself. Then I did my MD from PJ Medical College, Ahmedabad.
Yeah. And so this year only you passed out, and you actually this year exam was a little bit different from previous year. Still, you
Yes,
were
sir.
able to crack it with wonderful rank. So really, we as from Marrow side, we are really proud and we congratulate you from our side. And thank you for being with us because like this is something like we always when we are teaching or we are providing some source or resources, we want students to get ranks also. So we are also happy. So thank you so much, and we are really proud of you. So how was your approach towards the need? Before that, what is your plan? What are you planning? Like with rank 6, you can choose anything. So what is your plan right now?
Uh, yes, sir. So, sir, I was inclined towards cardiology from starting right from undergraduate days, sir, actually. So, even while entering MD, I was very much clear that I would pursue cardiology in future. So, I'm going with cardiology, sir.
Great. And cardio like that is something which like when once you're doing your MD, you should like now the pattern of entrance has changed. Previously, I mean, it's like slightly back, like it was like a specialty paper, just like INSI. So people used
Yes,
to
sir. Yes,
prepare
sir.
for the specialty paper and they had to plan what they are studying. Right now, the students started doing like after getting the rank, they may change their opinion. So actually, that is not good for a super specialty, is what I feel, because you need to develop that interest toward the subject once you are doing your MD, because this is something you are going to do, like you're going to practice throughout your life.
Yes,
So,
sir.
so cardiology is really, definitely, really a wonderful field because I also did cardiology for 2 3 months.
Oh,
In fact, then I
okay.
left and then I joined DM Euro. Because when I was also doing my MD, I was so much astonished with the marvels, clinical findings, and all.
Yes,
And
sir.
I also like neuro. I was very much confused between neuro and cardio. And I took cardio initially, then I skipped, then I went to neuro. And so, how was your preparation, and how did you prepare for this? Plus, along with how did you prepare for your MD exam?
Yes, sir. So, firstly, I would like to say this year's exam was a complete surprise to all of
Yeah,
us because if
yeah,
we compare it to the last 2 years paper, last 2 years papers, it was completely different, and the questions were very, I would say, eccentric and not the typical ones which they would give from their collected question banks from the examiners. So the questions were from every corner of the book, from every topic, from every neglected topic, I would say, sir, right from amino acid disorders to rare syndromes, rare orthopedic syndromes were even asked there. So they asked this time from everything, and I think they wanted to try our long-term comprehensive knowledge and not just the preparation since the last 3 months, which we would do. They were testing our actually subconscious knowledge, which we would have acquired over this 10, 12 years in our medical career. So I think, sir, strategy of the examiner was like that. Regarding my preparation, sir, the base of the preparation, sir, actually, sir, what I did was on the important topics, which would our bread and butter cases, medicine cases like sir, diabetes, CKD, ischemic heart disease. That I watched the videos from Marrow, from the specialty videos, and apart from that, I did complete Rakesh sir's videos of general medicine that would cover the Harrison from. And yes, I read Harrison. Uh, Not, I would say, completely cover to cover, but every important aspect and uh, regarding adult medicine part I did from Harrison. So the preparation, actually, sir, I got only after my MD exam, sir, I took uh, 15 to 20 days of break and I went on a vacation, and then I came back and started to study. And and in that, sir, I didn't have much time, so I relied completely on what I read during my MD days, and I did question bank thoroughly, sir. This is what I did, and sir, the last 2 year I reviewed it completely along with the topics, sir. I focused more on the topics rather than the direct question repeats. But I would say it would be a futile exercise since the question paper entirely was unexpected and changed this time. But however, it is important in every exam to review the last year papers. So yes, sir. This was like my strategy.
Two things. One is like you were telling Harrison, nobody can study cover to cover a textbook, like, and that is
Yes, sir.
purpose for MD, or that is not purpose for examples, because no textbook is complete. Everything has flaws. Everything has a goods and bads. So basically, you have to follow the guidelines. You have to get the concept correct about each topics. And the second thing is, this time question paper actually, usually the what you believe, these are the major super specialty, subspecialty areas where the questions are coming. It is totally shattered this time. They were
Yes,
asking
sir.
what questions from like very usually unasked areas, usually unimportant areas, and even the questions which came in the neuro, because I had just gone through the majority of the neuro questions and most other questions also. So in the neuro questions, actually, most of them were not a pure MD level, slightly higher level. Usual questions,
Yes,
usual
sir.
pattern of questions, usually asked in INA level questions were there, and those questions, even though it looks tough, but there are some cue. Sometimes they will keep a tougher image, but either in the options or in the question there is a cue which you don't need the
Yes, sir.
image. That is a pattern they cut, because they want the, what I felt is they want the whoever is writing to be get confused. And
Yes, sir. Actually, there were many questions in which the question looked very complex, but the image and the options made it very simpler.
yeah, and also and this time there was three parts, no, part A, part B, part C.
Yes, sir.
So when some of the students told me that when they're attempting, their part A contains all the tougher questions, so they didn't get time to finish part A. And part B
Yes,
and
sir.
part C was simple questions. They had enough time for part B and part C, but you cannot come back and do the part A again. So it was
True, sir.
almost
True. Yes.
three separate exams in same time.
True, sir. Yes, yes, sir. That was a problem. Part A was made very tough, but the part B was a little bit less tough, and part C, I would say it was the easiest. So in part C, I got, sir, almost 15 minutes of time to review, versus in part A, I hardly got 2 minutes to review my 10 questions. So there was virtually, sir, no time to review part A. So this was a bit imbalance in their part to create the set, sir.
So this time paper, actually, for those who are writing next time, uh, this was so much surprising. Like even if you are writing a three-part exam, you don't get time in between that. So it will be like each part is very tightly packed, and especially the first part, the questions were very lengthy. It was more clinical questions, and it was like USML like questions. So it took a lot
Yes,
of
sir.
time to scroll for the screen. So when you are going to attempt an exam, if the first few questions become tougher, you will get tensed, and that
Definitely.
tension was carried over for the entire 50 questions. So
Yes,
that
sir. True.
many of those who have studied well, because what happens is that they are testing your mental resilience also. You have to be you have to be very calm in the exam, because even if tougher question come, you have to be very conscious about the time, and you have to be very conscious that it is just 50 questions. You have another two parts coming. It may be easier. they are not going. Nobody is going to keep all the 150 questions same pattern. So I
Yes,
think that has started many of those who had very confident in the exam before the general test and everything. Some of those students even messaged me, I'm very confident, but after seeing the first part, I lost my confidence. So that happened during the exam. So
yes, sir.
next time also everyone who is preparing, just be calm, patient, composed during the exam, because your mind should work properly. But especially the question, I remember one question was like they had kept some cavernoma image, they had kept some eye image and all. So like that question may look tougher, but actually if you just look at the image, it is easy to solve it. You don't need to
Yes, sir.
read the entire theory and all, entire question and all. You don't need to read. And sometimes
Yes,
even
sir.
the options are telling the answers. They are given some about organic acidemia.
Yes, sir. Yes, sir. Many questions were like that. So if we
Yeah,
worked bit smartly in especially sir part A, then we could have more time for review because all their motive was to scare us in part A.
yeah. That I think like even the examiner wants to like confuse you, that he want you to spend time there, but there was some easy option given there. Your presence of mind will help you to answer very fast. So that
Yes,
is
yes,
those who are had difficult time with this time exam, just keep in mind this was a pattern. I felt the exam pattern was, this was a basic idea of the exam, how the exam question was set. So, and how was your preparation for your MD time? Because MD time also you have your long cases, everything. So you might have gone
yes,
to
sir.
super specialty part for long cases and all. So how did it help you for in the long for your exam as well as for your NEET?
Yes, sir. So, sir, right from the empty days, I would specifically look at the treatment part in Marrow. I read Harrison and Up to Date and other sources, sir. But I used to look at the treatment part specifically for Marrow. If I wouldn't have the time to read all of it, I would specifically look for the treatment part because it will help us take decisions in our routine cases in the ward, sir. So in that way, also, it is indirectly preparing us for the exam, sir. And specifically for MT examinations, I read Harrison well, and the important topics I read from Marrow SS part and general medicine from Rakesh sir I did completely.
Yeah. So how did you use our like MCQ and test series?
Yes, sir. MCQ and sir, question bank. I actually sir question bank. The general medicine part. I I got less time because I started late from for the NEET SS specifically. So to solve the question bank, I got less time. But what I did, with whatever time I got, I solved all the subject-wise tests in the Marrow test series section. So I did that, sir. And all the live GTs which would come after February, I gave all of that. The latest GTs, I gave all of it, sir. So that way, I focused more on the tests, the subject-wise test, and question bank. I could not complete it. Couldn't complete it thoroughly, but I did majority, like 60 to 70% I could complete.
Yeah, and did you watch like any part of the videos you feel this part, these topics or these videos you liked much, and any reason for that, or at least any topics like person, not videos, you're like the areas other than cardiology, because obviously you like cardiology, so
Yes,
obviously
sir.
you have interest towards cardiology.
Yes, sir. So for cardiology, definitely, sir, I watched Nishant sir's videos multiple times because I gave INI also, sir. So for the INI also, I completely watched Nishant sir's videos, and they were very helpful. Used to watch it multiple times and would revise the notes as well. For neuro, sir, I watched your stroke videos multiple times. Sir, for stroke, I didn't study the notes. Every time you used to play your video only. So I used to play it in 2x and then I would revise it with the video itself. So in that way, for multiple other subjects, topics also, so, I revised in this manner, sir.
Yeah, and when you're telling about Harrison, no, like if you take neurology, if you take stroke, the Harrison stroke is not that great. Harrison.
Yes, sir. Yes, sir.
Majority of the treatment, majority of the pathology doesn't cover actually, in fact, anything. They just tell about many of the
Yes,
studies.
yes.
And after reading Harrison, you will be confused whether you should give
Mm.
this, you should do that. You're totally confused because they are not touching the guidelines properly. And even if you take GBS or a CADP per se, or even if you take muscle disease, they
Yes,
are
sir.
giving you an understanding what it is, but they are not going to the
Yes, sir.
detail. They are not going to tell about how to manage or what are the drugs. That area is still very much confusing in Harrison. And when to give, when not to give. Those
Yes, sir.
things
Agreed.
you will get only from a specialty books or from guidelines. And for that, you have to go behind multiple guidelines. I think in that way it may
Multiple. Yes, sir.
help you guys, especially during your MD days also.
Yes, sir. Definitely. I would say, sir, the same. I never liked the neurology part of Harrison, sir. It made me more confused at the end. So yes, sir. So I did the practical books, especially Khadilkar sir's book. I read a lot. Then, sir, concessions, reviews, articles I used to read to clear the confusion. And for the treatment part, specifically, I referred to the Marrow notes because I thought they would be the most updated ones.
So right now you've got sixth rank. So like you are planning to take cardiology. So what is it? Have you planned to take any other place? Because you will get cardiology in any place, I think. Because usually the
Yes,
top
sir.
rankers go for like nowadays the trend is like top rankers go for less interventional, more life-giving branches. That is what I tell. Like endocrinology,
Yes,
rheumatology,
sir.
because they have less emergencies, and you will have better life work balance.
Yes, sir.
That is one thing nowadays all students are looking into. Then why you are looking towards cardiology, and in which place you will be liking to take?
Uh, so yes, sir. So, sir, for me, sir, it was cardiology from the beginning itself. And right from my undergraduate days, sir, used to I used to read ECGs from the ICUs right from my undergraduate days. I used to stand in the echo, which the cardiology residents would do during my post-graduation days. So, sir, my tendency towards cardio was from initial days itself, from undergraduate, and it carried on to post-graduation as well, sir. And secondly, sir, from initially only I was inclined towards an interventional branch. So, before entering MD, I made a decision that I would choose an interventional branch in the future, most likely cardiology or perhaps gastroenterology. So I always liked doing anything with my hands, and that would give instant treatment gratification for me as well as for the patients, sir. So in that way, with the subject interest and with the liking towards an interventional field, I have chosen sir cardiology, and I have inclination to join Sir Jaydeva
Yeah,
because my two seniors from my same institute are in Jaydeva, and I'm in constant touch with them.
yeah.
So
I did my MD
yes, sir.
from
So
Mysore Medical College. So I know we had posted for the other also. I know how the work is there. It's one of the best places in cardiology.
yes, sir. It is the Apex Cardiac Institute. So mostly, sir, I will join Jaydeva, but I will also look out and for Delhi, sir, colleges, specifically BMMC and RML, sir.
And in Jayadeva, one good thing will be language may not be much issue because in Bangalore, you can survey with Hindi. You can most of patients know Hindi, so it will be easy to survey. Unlike in other places, like you have to learn another language, that will be a bit difficult. But for cardiology, it is not much difficult because cardiology, unlike neurology, you don't need much detailed history. Neurology is one subject you need to have an understanding of the language to take
Yes,
the
sir.
history. And so,
If neuro or neuro it is.
yeah, basically you
Yes, sir.
were like,
I'm looking forward to it considering Bangalore is a cosmopolitan area. So
yeah,
I hope there's not much an issue with the language, but I'm eager to learn Kannada as well.
you know Kannada.
No, sir. I'm looking
Yeah,
forward to learn it.
yeah, yeah. Yeah, yeah. And I also learned Kannada after going to Kannada. It's not difficult. It's not tough to learn. It's easy to learn. And
Yes, sir.
like, so you basically had followed. I mean, majority of Harrison, plus you watch Rakesh Shah's videos, which give the concise and much better idea and much better concept. Because Rakesh Sir being my teacher also, like he taught me when
Yes,
I
sir.
was finishing my MBBS. He was doing, I think, second year MD medicine. At that time, he was taking classes in entrance coaching. So I joined his classes and I started my interest towards medicine after watching his classes. So I know how how he can inspire. So uh,
Definitely, sir.
then you started looking at the cardiology. You might have read because you were planning for INA also. So you have to go through and your favorite subject. So and that the how Dr. Nishant has taken the cardiology, that is actually really good. Like it will help you even if you're going for your DM. That definitely going to help you because that he had made it so easy and he had covered almost everything with the echo diagram and everything. It is very beautifully taken. And then you had watched some of the important areas which you used to get in questions during the class or clinically relevant things from other super specialities, including neurology. So, and
Yes, sir. Watching sir Nishant sir's video is just like seeing a movie. It's like he starts from right from the history and takes you to the advanced concepts and the treatment paths, and doesn't miss out any concept, including complicated echos and ECG images. So it is like very smooth, and you can watch it multiple times, just like watching a movie.
yeah, yeah. So that will help you further in your DM career also. Like if you let that will give you the
Yes,
more.
sir. Definitely.
So
Yes.
basically, those who are going to write next time also, you have to be strong in your subject right from the first year of MD medicine. Nobody
Yes,
can
sir.
provide you some capsule which you take 1 month or 2 months prior to exam, crack it, get a beautiful rank. That is difficult because that is
Yes,
the
sir.
purpose of writing the exam. If you are writing the exam for MBBS, after MBBS, you're going to join an MD, that may be a different scenario where you are compelled to do that. But here it is like you have a wonderful degree, which I feel much worthier than any other degrees MD medicine, because you can manage any case, and that is one of the most beautiful subject. I feel like MD medicine is one of the most beautiful subject. So because you can learn lot of things. Your knowledge should be very vast.
Definitely, sir. Yes, sir.
So with you have to love your subject during the MD days, then you plan about your future. What is your opinion? Same, no?
Definitely, sir. I would say if I was not if I was not this much inclined towards cardiology, I would say I would have remained a medicine as well, and I wouldn't have any problem with it because just because I'm liking cardiology, I'm taking it. Otherwise, I'm very happy and I love internal medicine.
Yeah, I want to ask you one more question because I just was going to my mind right now. Like you were going to the part A of this type question paper. So when you see the
Yes, sir.
part A questions, like they have a huge question part, then they have an image,
Hmm.
then they have again huge option part. So how do you
Yes, sir.
approach those?
Sir,
What kind of stuff?
for such questions, for such lengthy questions, which would take a lot of time, I would read the last line of the question and try to get an insight of what are they asking, and am I able to guess the answer just by looking at the last line and the options? If I'm not able to do so, I would read the entire question thoroughly. But if I'm very confident that just by the last line and the options will be able to get the correct, I would just run through the question and not read it and I would not take much time in that. That was my strategy. And same for the image-based question, sir. I would see the image first and the last line of the question as to what are they trying to ask. Then I would see the options, and then I would look at the question and decide myself that is it necessary to read it in detail or will it be okay. So, sir, the part A was specifically difficult, and they tried to judge our medical instinct rather than our recent recalls.
Yeah.
Sir, the part A specifically was meant for that, sir.
Yeah, actually, even I felt the same thing. Like when you are seeing a last question, especially in clinical scenario questions, they want to judge the what you have seen the last 3 years, what you have at
Yes,
least
sir.
heard during the last 3 years.
Yes,
Uh,
sir. Yes, sir.
well, I'll tell one example of question was that question about organic acidemia. So there was an image. Even if you have never seen the image, you just see the option first. All the options are acidemia. So it means that the question is regarding organic acidemia. Next, there was macrocephaly with dystonia. So that will tells you directly the diagnosis. There is no need to look at the image also. So So there will be that
Yes,
that's difficult question. Those
yes,
will
sir.
write next time. Next time, just be careful. Like when you have a difficult long question, just follow what he is telling. You can actually go through the options, then see the crux of the question. If it is tough, you have to think the way the examiner has thought. What he might have meant, you will get from the options and the question. Then you answer like that.
Yes,
The
sir.
MCQ is made like
And
that
sir,
usually.
remaining calm is also important because by seeing such a question which seems out of our league, anyone would feel very nervous and we'll miss out the small clues which would help us immensely in getting the answer. So it is very important to stay calm and trust yourself when tackling such questions.
Correct. And you have to keep in mind that if you have prepared reasonably well, any tough question will be tougher for others also. So don't get
Yes, sir.
panicked.
That definitely. Yes, sir.
So, uh, so all the best for the future, and
Thank you, sir.
hope
Yes, sir.
we
One
will.
more strategy I would like to pinpoint, which helped me during my preparation. I use, sir, in my iPad, I use OneNote and Good Notes, the app, very much. Sir, so in that, sir, I would keep snapshots of my written notes and the tables from the Harrison, from the PDFs in whatever form, either the clicked photo or the screenshot from my PDF. I used to bring them together in one sheet and I used to create flashcards with that or a PDF, a whole book with that. And that book I review on the last 2 days before the exam. Sir. This strategy I've been following in sir NEET PG, INI as well as this NEET, sir. So this I think is very helpful in last minute revision especially, sir. And there are few topics, there are few weak areas for everyone. So you have to figure it out yourself. What are your weak areas, and that also you can keep in this uh, book, and you can review this anywhere, like uh, like attending a ward round. If you are standing backwards and you are going with the round and you have nothing to do, you can just scroll that. So if in that 5 to 10 minutes also, you can read 10 to 15 of your last minute revision pages, which is very handy.
And what is the app name you are telling?
Sir, I use Good Notes application a lot.
Like,
So that app offers good flexibility, sir, for us.
yeah, I will also start using it because I'm not that techy music till now. I have to find out some way. I am still back to that old textbook person. So all the best for exam, and very happy to have you there here, and happy to have a chat with you. And
Yes, sir.
I wonderful colors for sure, because you have the aptitude, you have the calmness, you have the humbleness. You'll definitely reach great heights, and keep it
Thank you
nice.
so much, sir. Thank you so much. Sure, sir. So it was my pleasure and honor. Completely. Thank you, sir.